Do you ever wonder, how do I know if I have bad breath? Or why your breath still isn't fresh even after brushing or rinsing or mints? Well, as a periodontist, I see it all the time. Chronic bad breath, or halitosis. It isn't just a social issue, it's one of the very first warning signs of gum disease. Now, if your breath doesn't stay fresh, it might not be your toothpaste or what you actually ate. It could be bacteria living underneath your gum line. About 90% of ongoing bad breath starts right here, in the mouth, not in the stomach. When plaque builds up and hardens into tartar, those bacteria release sulfur gases. That's that rotten egg smell that people actually notice. Think of it this way. Imagine there's leftover food in the refrigerator from Thanksgiving, but nobody finds it until Christmas. It's been sitting there quietly breaking down, and by the time you open the container, that smell hits you. The same thing happens underneath your gum line. Old food particles and bacteria trapped beneath the gum line start to decay and release an odor. So when you notice persistent bad breath, that's often what you're smelling. That hidden breakdown happening below the surface of the gum line. And when those bacteria slide below the gum line, they don't just cause an odor. They cause inflammation. They cause infection, and they eventually create bone loss. That's the start of periodontal disease. And that odor is often your body's way of sending you a red flag. So, if you're wondering whether you might have gum disease, bad breath that just won't go away is really a big clue. Healthy gums don't bleed, and healthy gums don't smell. But when they do, it's usually because bacteria is trapped underneath the gum line. So here's a trick of how you can check at home. Use dental floss between your back teeth. Wait a few seconds, and then smell the floss. If it smells sour or metallic, that's actually bacteria hiding between the gums and the teeth. Or try a simple hand test. Lick the back of your hand, let it dry, and then smell it. If it's unpleasant, it's time for a gum health check. Now, not all bad breath comes from gum disease. Sometimes it's dry mouth, certain medications that you might be taking, sinus issues, or maybe something that you ate. But here's the myth. Most people blame food, when it's really bacteria releasing gases long after you finished eating. That's why mouthwash and mints only mask the smell for about a few hours. They don't treat the infection that's causing it. If you've noticed persistent bad breath, bleeding gums, or a sour taste, it's time for a perio exam. We'll measure your gum pockets, we'll check for infection, and we'll find out whether there's bacteria living deep below the gum line. Because healthy gums don't just look good, they should heal and stay fresh. When gum infection causes bad breath, a standard cleaning usually isn't enough. Those bacteria live way too deep underneath the gum line for those instruments to reach. That's where LANAP, or laser gum treatment, comes in. The laser removes the infection, it sterilizes the pocket, and it helps your body heal. It helps your gums reattach so that the odor can be stopped at its source. No cutting, no stitches, just your body healing once the bacteria is gone. So if you've tried everything, you tried brushing, rinses, gum, and your breath still isn't fresh, don't be embarrassed. It's your body's way of asking for help. Schedule a gum health consultation with us, and let us find out whether gum disease is the reason behind your bad breath. I'm Dr. Fatima Robertson, a board-certified periodontist right here in the Dallas-Fort Worth area. And if you feel like you need a healthy gum checkup, contact us at the information below. And if you feel like this video was helpful, hit subscribe or share it with someone who's been putting off having gum treatment. Drop your comments in the section below, because a healthy smile is something everyone deserves.